if we speak just to housing, that's kind of the hub of how healthy you're going to be, or a metric for how healthy you can be. Is if you don't have safe and adequate housing, you can't. All the other areas in your life are going to be in a crisis point. What we see right now in the Vancouver area is housing is a real issue. For families, it's very difficult to find housing that they can afford that's sustainable. Rent prices have skyrocketed. If the child is supported and the basic needs are met, they're going to be successful in school. If they're successful in school, they'll be successful in life. And so our whole goal is success for the child, success for the family. And so we're eliminating barriers.
When a person who's struggling with mental illness or chemical dependency is in a housing situation where they have support for those things right there, it greatly improves their ability to remain independent in their home situation, whatever that may be. And that's the beauty of the community health worker program.
Community health workers are a way to bring that voice of the folks who badly need those services or need better, more effective services to the systems whose job is to deliver those services.
You're thinking about the problem as just housing, and that's the problem you need to solve, but it ripples out from there. You have a place you're staying. Awesome, let's figure out the bus route together. Let's come up with ways that this isn't as much of a barrier.
The thought has kind of gone away from requiring the person who's needing help to go to this agency and that agency. Any place they go, ideally, would have an array of resources available to that person. So they don't have to be savvy about how to find these things. The health department, ideally, our clinics, different agencies would have all the things that they could share with the person.
There are agencies that we've always referred families to, like coming from the school district. We're aware of the social service agencies within the community that could support families, but the whole Courtyard Village crisis really solidified those relationships.
Courtyard Village that was sold to a developer, and someone came in and rehabbed and asked all those families to leave. And it was a traditional building that traditionally served people who were low income. And through the Healthy Living Collaborative, we were connected to managed care organizations, and they took that address for Courtyard Village and they ran their members and realized that our populations are the same. It kind of brought home that why we're all trying to do this together in the homelessness system or the affordable housing system are the same people who are on Medicaid, are the same people who are our neighbors who have problems with transportation and food as well.
And we were able to raise about $100,000 within a very short order of time in a housing relief fund. And it was the schools kind of like, well, we can't manage this money. It doesn't work that way. And so right away, we approached Council for the Homeless. They administered the fund. We recognized that we need to let the experts be the experts and send people to where they needed to go. It was a great merging of relationships.
Getting everybody to the table, payers, providers, social determinants of health, people from the community, to start having those conversations of how we transform the way we deliver care in a more whole person way.
What you might expect when a new set of ideas like this emerges is that people would really tend to want to go back to the way it's always been. And I really think people are rejecting that notion, and they're just kind of embracing the future and what might be possible. So that gives me a great deal of hope and enthusiasm.